Good morning, everyone. Welcome to our show. This morning we are going to be discussing the 3 top causes of acne and how to treat them, both with in-clinic treatments and also naturally. I'm Becky Wilkins, registered nurse and health coach here at External Affairs. Welcome. The topic of acne is very dear to my heart because at 49 I still suffer from breakouts, which is not fair. I think that we should get to outgrow one thing before we develop other things like chin hairs. But no, at 49 you get to have them all. So I'm very passionate about talking about acne. So what I thought I would do is, first of all, try and connect the dots, because I think unfortunately in our industry, people try to get treatment for acne and it's really disjointed, So for example, you can go to your doctor and get a prescription for antibiotics, and that will help, or you can go to the health food store and get some advice there, or you can go to a spa and have a facial, and they're really not connected. So that's really what my goal is today, is to connect those dots. So, this talk is not only for people in their, teens, 20s, it's beyond. We're seeing more and more acne definitely in the 40 and up group. So let's get started. So number 1 cause of acne is basically it's bacterial, okay? So bacteria in the skin. We're going to talk about that. Number 2 is hormones, those dreaded hormones. Oh so good and oh so bad. And then number 3 is nutrition factors. So this is where we really need to connect all 3, because nothing is standalone. They all go together. So what I'm going to do is I'm going to show you a picture of the skin and basically what happens with acne. So we've got our top layers of skin, and they kind of build up the dead skin cells in time, kind of like bricks and mortar on the skin. And then underneath that layer, we've got our follicles. So these are follicles, okay? Now what happens is our pores or follicles are lined with dead skin, okay? And we all have this P. acne bacteria in our skin. It's there, all right? Now what happens is sometimes with hormone fluctuations, so you think about teenage boys, all of a sudden they've got acne. It's that bump up in testosterone, stress, all of those things that can alter hormones, perimenopause, there's just so many different phases in life that can alter the hormones. And when testosterone gets bumped up, we see an increase in sebum or oil in these follicles. So what happens now is they get clogged. The bacteria loves this, I call it sludge in these follicles, and the bacteria feeds off of it. So now all of a sudden we get these inflammations down here, and that can create, infections and all sorts of horrible things. So what I'll do now is kind of break apart how do we treat it, right? So definitely we want to deal with this top layer of dead skin, because as long as this is building up, it's closing off these follicles. And if you think of, a blackhead, the pores, it's still open. And the only reason, the sludge is black is because it becomes oxidized, all right? So when it becomes like a whitehead, what's happening is the tissue over top, it's kind of impairing the release of any of that oil. So the first thing we need to do is we need to get this dead skin off on a regular basis, but gently. A lot of people that have acne, they get over aggressive in trying to get that layer off, and they can irritate the skin even more and end up with a bigger problem. So that's thing number 1 that we want to do. Now we can do that with, a glycolic product, like a glycolic gel, something like that, that just speeds up the cellular turnover here. We can do it in the clinic with a series of, chemical peels, usually a salicylic acid peel. We can do that. The other thing now we want to do is we want to kind of clear out the sludge in here. So we do that with products usually that have combination, like glycolic acid, salicylic acid, because they help break down that debris in here. And again, you have to be gentle, but that can be really effective, as far as just doing at home. I'll talk briefly kind of about medications because, like I said, definitely antibiotics are kind of the go-to product, but unless everything's being dealt with, the antibiotics are just going to be a temporary solution. And then of course the antibiotics can create a whole host of gastrointestinal issues, which long-term, can create more inflammation. So you really need to choose wisely, with your doctor about sort of which medication route you're going to go. The other medication that is more commonly used, especially in our clinic here, I know Dr. Briggs is a big fan of using a product that blocks the androgens, which is the male hormone, at the site of the follicles. So that's an oral medication that can have, really nice improvement, especially on our perimenopausal women, okay? Just to block the action of the testosterone at the skin, all right? Now let's get into nutrition because this is by far probably one of the most effective ways of treating acne, and if this gets missed, I really believe you're wasting your time on products, treatments, all of that kind of stuff. So when we talk about nutrition, there are definitely some food types that are inflammatory, okay? And not to everybody, but for people who are sensitive to acne, dairy, okay, is probably one of the most inflammatory foods out there, all right? It is so full of antibiotics, chemicals, hormones, everything, and it just produces this whole cascade of problems in people that are prone to acne. So over the years, I have often told my acne patients, just take dairy out of your diet for 30 days, see what happens. And I've had so many people come back and say, oh my gosh, that helped me, Then we can do the treatments to kind of clear up sort of what's left behind, but sometimes getting that dairy out is huge, all right? The other one is sugar, all right? Now, sugar, most people think of candy, things like that, but really sugar in all its forms can also be extremely inflammatory for somebody who's acne prone. So that's the other thing that we say is really decrease, it's the glycemic load of your diet, because if you're eating a diet that's very high in glycemic, so for example, your pastas, pastries, French fries, all that white bread stuff, again, it causes a release, a whole hormonal cascade, and for people who are prone to acne, that can be a real problem. So sometimes really decreasing the glycemic load of your diet will often clear up the acne all by itself. So that's another one. When we look at nutrition, we also want to look at supplements. Quite often our diets are kind of lacking in certain supplements that can really, really help the skin. So, a probiotic can be super, super helpful, especially if you've got tummy issues, gut issues. If you've got inflammation in your tummy, for some people that's going to show up on their skin, either in acne or eczema or psoriasis, anything like that. So definitely getting on a probiotic is super helpful. The other thing that we can be deficient in is our omega-3 fatty acids. So especially if you're looking at teens and things like that, they're not eating fish, not in my household anyways. So definitely supplementing with a really good omega-3 will help, boost those nutrients that's needed to keep the skin clear. It has a really anti-inflammatory effect. And then, my go-to is just an excellent multivitamin. We need zinc, selenium, vitamin A, vitamin C, all of those things for our skin to repair itself. So just a good multivitamin that kind of covers that basis. So, that's what I put my son on anyways, and as long as he stays off dairy and sugar and does the supplements, his acne really, really does stay clear. So I hope that's helpful. After this video, we're gonna post a couple of videos and links to some articles that really connect the nutrition component. If you do have acne, please come in and see, one of our docs or one of our skincare specialists, and we'll get that sort of path rolling for you. And again, it's no standalone treatment. The key to clearing acne is really looking at the whole person from the inside and out. So I hope that's helpful. Thanks, have a great day.